Right, hello everyone. I'm really sorry to disturb the break, but otherwise the other theme is running late as well, so we have to stick to schedule now. So if you would love to talk about social care, please stay in this room. As Ben was saying, the other room is women's health. Is the click, do we have the click? Right, so Taylor is going to share some of the agenda now. And right, so are we all seated? Cool. So welcome everyone. There are a few gadgets I'm going to use in a bit, so just bear with me, and thanks for the tech support in the back. So first of all, welcome to the first social care theme meeting of the ARC Northwest Coast Phase 2. My name is Clarissa Giebel, and I'm based at the University of Liverpool, and Dr. Catherine Knighting at Edgehill University is the co-lead over there. So we will ask you to move about in a little bit, but for now, stay put. Right, let's see whether that works. Okay, so phones out, please. Do we have the slide with the question, tech team? Yeah, is it on the next slide? Yes, I would love to hear from people scanning that QR code or joining on Slido. What do you think when you hear social care? I know, put anything, but no expletive language, please. Expensive care, chaos, lovely. Elderly care, nursing home, holistic, yeah, it's funding restricted, older people being cared for in the community, underfunded, yep, sadly so. Care packages, it can affect you throughout your whole life course, yes. And it's separate to the NHS and healthcare. Anything else? Not enough capacity, poorly supported, but I suppose most of it is support and care home. That's probably what many of us think when we hear social care. Anything else? End of life, yeah. And throughout the lifespan and assessments. Yes, people should go through a social care needs assessment to see what social care services they can be eligible for. Okay, I'm going to cut this here, and I'm going to pass over to a video for 1 minute and 28 seconds only, otherwise you get something that's not relevant. Listen to this, please. Can we have tech and stop at 1 minute 28 seconds, please, if that's possible? I'll explain to you why I'm letting Gillian say a little bit.
Hi, sorry, can I have a minute of your time? Thank you. I'll get straight to the point. I'm sure you're busy, but it's important. There's something really crazy, concerning, ridiculous going on. Well, there's hundreds of things, but let's stick to the one thing that we could maybe do something about. Apparently, women over 50 are disappearing, becoming invisible. I know, it's like a Hollywood plot twist. You're noticed, you're needed, you're whistled at, you're even hit on, and then poof, a few years later, you don't exist. You're in the way. They wonder what the hell you're still doing here. Come here, stay with me, I'm not done. You see, it's about more than just women on screen. It's everywhere in our society. Some people, gentlemen, the youth of today, sometimes forget that we're their mothers, their sisters, friends, spouses. It doesn't seem to shock anyone, or for that matter, concern anyone that we become invisible. Nor, I might add, does it occur to us that when we judge other people, when we participate in ageism, we're forgetting that the very same thing in time will happen to us.
Thank you. Now, you might think, why is that not in the women's health theme? She puts a few nice words there about, I feel we forget a lot about social care and we only get reminded of it in society when we need it. Politicians don't think about it unless their mother suddenly needs to go into a care home. But also, let's point out that the majority of the care workforce are women. So within the social care theme, we will naturally look at unpaid carers, paid carers, and thus women a lot as well. So there is a lot of crossover across the themes. But I just wanted something that's a little bit engaging that says we forget about social care far too often in society. So I'm going to, and here, as a recent report by the King's Fund has also said, it doesn't seem to be my priority, it's not my priority, social care. So King's Fund's Health Foundation, they do really great reports on the status of social care. You may be familiar with Skills for Care. They do annual reports about the status of the English social care workforce, etc. So many people do not understand the basics of social care, who provides it, how it's funded, and what it does. So hopefully, by having this theme here in the Northwest Coast, we can show that we are creating research and capacity within the social care sector. So the aims that we've written into the bid are to co-produce solutions to help people of all ages to access social care equitably. So not just older adults, not just working age, end of life, but also children. We really want to focus a lot on the unpaid carers as well in their role. They're far too often neglected. And we want to co-produce and test ideas. So now that we're going into phase 2, we've done quite a bit in ARC1 in some of our areas. Now we want to spill that over into other population groups, ages, and we want to move towards implementation. What can we do with some of the good things we've done? So the social care theme, this is us. I'm really pleased that we are also joined by our public contributor champions. So Children and Working Age Disabilities is led by Catherine Knighting from Edgehill University. I'll be continuing older adults and dementia, and Stephen is there as well for end of life and palliative care. And if Kath and Jackie could wave their hands in the back, you are our public contributor champions. Very pleased to have you. So this is us. What will we do? Obviously, we will be attending ARCFEST, hold meetings such as this. We have 3 virtual theme meetings a year. At some point, the plan probably in year 2 is to merge with the other social care themes from the other ARCs as well and do a bigger social care event in person, because we want to collaborate across the areas and ARCs. And we have the sub-theme meetings as well, which are being set up in each. We want to continue to co-develop research, as you know, like all the other themes, and jointly with our members and public advisors, of course. And I think a really big thing for us, obviously we have capacity building across the ARC, is also to continue the internships with social care practitioners from care homes, such as via the Living Lab in Aging and Dementia, and obviously host PhD students. So in ARC1, we've supported some frontline staff working in domiciliary care and in care homes to do a 12-month funded research internship on their own projects. So we really want to continue this, and now to go over not just to care homes, but to other social care sectors as well. This is an old image. I did these slides before the new map was out, but just to reiterate, we don't just want to work in silo. We don't just want to work in the Northwest Coast. We want to link up. So far, I'm aware that the ARC in the Oxford region and ARC East of England, they have their own dedicated social care themes, and there's pockets of social care knowledge and expertise across the other ARCs as well. So we will be linking up and working together. And obviously, just to stress again, like we've done in ARC1, any project that we design, come up with, will be developed from the ground with the ideas and lived experiences of public stakeholders and professional stakeholders. We will regularly consult with people working in social care practice, care homes, residential care, etc. So, if you want to get involved, we've already got the upcoming social care theme meetings in the diary. They, for year 1, will be virtual. We have set up a mailing list. You can email either of us, myself or Catherine, or you can email the generic ARC Northwest Coast email and we'll add you to the calendar invite for that. So there you go. And briefly, I'm going to share with you a couple of things that we've done in ARC 1, specifically to older adults and dementia, because that really laid the foundation to develop a whole social care theme, and now branching out to the other elements of the life course as well, because we want to build on that. So here you see some of those things that we've done in ARC 1. We focused in the later lifespan and dementia specifically on trying to find out what are the inequalities and what are the solutions, possible solutions to dementia inequalities in diagnosis and care, including risk factors as well. We've got the Northwest Coast Living Lab, and we've got a growing work stream on supporting unpaid and paid carers stay well in an employment as well. So some examples here, which we will discuss in group tables afterwards as well. And we can see some lines of implementation developing on that in the ARC 2 now. Within dementia inequalities, which obviously in my research group is a big focus, we've got different areas that we're looking at and different solutions that are emerging. So some of the areas that we're particularly looking at is looking at some training for the social care workforce, including training on rarer subtypes of dementia, huge inequality. We are looking at care fragmentation, particularly with European countries as well and European colleagues. So why are health and social care not linked up well enough? That's usually a huge barrier for people in accessing care. You get the diagnosis, you come out of hospital, where do you go next? The link to social care and community so far isn't really there most of the times. And we've got a postdoc fellow as well who is doing work on dementia link workers. So those are some examples we want to work on. And you may or may not have seen we've got the children board game in the back at our table. We really want to build on the gamification of dementia education. Now, right now, this is all in person. We've developed both of these board games from scratch, based on research out there. We've tested the adult game in over 1,000 participants across the UK. We're now testing the children version across the Northwest Coast. We want to see how can we support training for the care workforce. And maybe this might go digital, I don't know. Also, what I have mentioned a little bit is we really want to now expand in the next 5 years on our Living Lab. So Living Lab, what's that? There is many different versions of Living Labs out there. They're not unique to the UK. They're anywhere, Netherlands, Australia. What we do here, building on our link with Maastricht University in the Netherlands, is we link up one researcher or PhD student with one care provider, and they're embedded within that care organization 1 day a month, or if they're funded, 1 day a week, to develop jointly ideas that frontline practitioners and managers have about, this is relevant, I want to know how I can address behavioral challenges in care homes better. I don't know, it really depends on what they suggest in collaboration. So this way, we want to continue building capacity and knowledge in the social care sector as well. And obviously, we have to develop grant applications as well. But we can support frontline workers to apply for internships as well. So maybe something like this, or communities of practice could be done within the other sub-themes as well in social care. Very briefly, another thing that we will definitely take through in ARC 2 is research into the relationship between work and health in paid and unpaid carers. We've been funded by the NHR. We're now submitting a follow-on program grant application. We're looking at Schwartz rounds as well. So this is a new area which we're definitely continuing within the social care theme. So if you have any questions about that, come up to me. I don't want to steal too much time from the other sub-themes. But also to highlight, social care Schwartz rounds will feature heavily in our sub-theme, which we've just been funded for. So just to say, within our theme, we need to bring in external funding, but we also need to pull through what we've done in ARC1 and develop that further. So if you are interested particularly in older adults and dementia, we have 3 in-person meetings in the diary already. We want to continue meeting in person. This is our last annual conference in March, because I feel we can network a bit better if we see each other in person, and there will be external speakers as well. And now I'm going to hand over to Catherine, who can then hand over to Steve.
Okay. Hi everyone, my name is Kate Knighting. I'm a reader in palliative and supportive care at Edgehill. My background is primarily around children with complex or life-limiting conditions and family carers, but also a developing program of work around children with neurodisability. So I'm the lead for this sub-theme, and this is a new sub-theme. So I'm not coming here to say what our work plan is, because although I have ideas like everybody does, I really want to hear from you as our partners around what you feel the needs are in the Northwest now. So what we want to do is build the network for this sub-theme, because that doesn't exist currently. There are some organisations who have indicated they're interested in this area of the application that went in, which is brilliant. So you will be contacted. But we're interested in building this so that we can do what everybody is doing, which is to co-develop that work plan for this ARC in terms of developing those communities of practice, for implementing findings, but also co-developing research and applying for funding. So I'm going to press a button, and it's the right one. Excellent. So this sub-theme in itself will also have 2 to 3 meetings across the year so that we can focus on this particular aspect. The first meeting will be the 12th of May online, and then we'll be looking to have an in-person one during the summer. So if you're interested and you're not already on the emailing list for this theme, please let me know. My email is there. And so that I can make sure that you're added to that meeting, or at least so that you're on that list for future notifications. And if you want to talk about anything to do with this theme, please speak to me. And I'm going to hand over to Stephen now.
Hello. Oh. Okay. Is it? I'm not sure. Anyway, okay. So I'm Stephen Mason. So I'm from the University of Liverpool. I'm from the palliative care unit there, and a bit like Kate with the Kate's theme. This is a new sub-theme, or a new sub-theme within the ARC, so it doesn't fall over from ARC1, but there is within the Northwest Coast, there is a academic network that's been developed from NIHR-funded collaboration money. So there's an academic network, but I think one of the things that that network can do is dovetail with these themes within the ARC, and particularly bring the patient and public involvement and engagement, but also the methodological expertise to look at some of the challenges that we have in palliative and end-of-life care. This was the information that was in the original bid for the ARC2, and you can see some of those themes there in terms of facilitating home and residential-based palliative and end-of-life care, supporting unpaid carers. These are quite big challenges, and you're probably aware of the challenges at the moment in the hospice setting, where we have a hospice in South Liverpool, which has now closed its beds. It's hospice in Southport, which is again under threat for closing its beds. But again, there is the challenge of how people are managed in the home care setting and how that's facilitated and how outreach services pick that up. Equally, the issue with the unpaid carers, I think it's endemic across all chronic conditions. Some really interesting work by Guna Grand in Manchester and her colleagues showing that primary carers of people with chronic conditions takes them about 4 to 6 weeks to develop psychological well-being, which is subpar and below the standard in the UK. And again, so the support networks and support for primary carers, which primarily is women, is pretty poor. So these are areas that we can potentially engage in. In terms of key implementation activities as well, there is this idea of how we kind of engage community models, and there is some interesting, innovative work that's being done looking at the use of community carers, and there's a lot of work within palliative care setting, which has looked at compassionate communities or compassionate care communities, and how you empower communities to provide some of that disconnection between structured care services and care services, which can then be owned and supported by those local communities, and not just developed from a top-down perspective, but what actually works from a bottom-up. So we do have a meeting. We do have a meeting planned and date. Sorry, I did send you an update slide, but it's on that slide, but I can't remember what that date is. So we will circulate that. We have a date in the diary. I think it's sometimes toward the end of June, which will be an open meeting to try and establish what the priorities are, where the areas are that this sub-theme we'd like to move. But again, there's also a sub-theme within the long-term conditions, and I think palliative and end-of-life care is probably a sub-theme across women's health and public health as well. So we may keep popping up in different guises because it kind of straddles most of the kind of key themes. So yeah, I'm happy to take any questions at the end or when we have our table at the beginning and share email contacts. But yeah, that's from me.
So we'd love to move into some group discussions, but I just want to give an opportunity. Does any of you have any questions to any of our sub-theme leads or public contributor champions at this point? Yes, in the back. Yeah.
Thank you. Yeah, just a question about the children, the age in particular. I've got a son with a severe learning disability, epilepsy and various other things. He's 42, going on 6. And his mum, or rather my wife, keeps reminding me, he's a 6-year-old. But he isn't, he's a 42-year-old. And I'm wondering, do you have a particular thing, right, say, right, 18th birthday, nothing to do with us anymore? Or do you tend to keep them beyond that age? Yeah, well, implementation in particular, I guess.
Well, it's children and... Oh, sorry, yeah. I'm normally so loud, people can hear me anyway. Oh, sorry, yeah, of course. We're not specifically looking at any age cutoff because it's children and working age adults, so it would be quite a broad age range. So absolutely, that's a conversation for us to have. Yeah, okay.
Great. Any other questions at this point? No, I think we're all waiting for the cookies at 3:45. I was told by Anne will arrive and Ruth is nodding. Excellent. So we would love to not split you up, but we'd love to reconvene all of you into your main area of interest. Obviously, you may be interested in all 3, but if you could perhaps pick, would you like to look into children working age disabilities, older adults and dementia, end of life and palliative care? And may I suggest perhaps, who would like to move to the end of the table? Kate? Kate. Who would like to have a chat about children working age disabilities? And follow Kate to one of the tables. Stephen, maybe if you move to the middle, perhaps? Yeah, and then we have end of life and palliative care in the middle. And then we'll stick there for older adults and dementia. So, thank you.
I don't know what's been asked to. Hello, can you hear me? Yes. Is that Anne? Hi, Lisa. Yeah, so my name's Will Whitaker, and I work with Clarissa. Unfortunately, no one's sorted anything to facilitate discussion with the online participants, so I'm happy to try and help here. So the general question is, what areas of research and implementation would you like to see focused in the short, medium and long term? Do you have any specific ideas based on previous ARC work in the topic area? And I'm happy to use the chat if that's easier. I don't know if you're getting an echo like I am. Thank you, and sorry again for this. I've just jumped on to try and help. So I don't know if you've got the actual question that I just read out. I'll type it in the chat as well.
Should be able to sort of normally. So if you put them on, that's got a microphone in it, so we can mute that.
Okay.
Should be able to hear you now.
Well, there's definitely not an echo now, which is good.
You're unmuted, so people should be able to hear you.
Okay. Thank you. Sorry, I'm just trying to work out the sound here as well, everyone. So we have got 3 areas: children and working age disabilities, older adults and dementia, and end of life and palliative care. And there's probably different areas of research for each of those different sub-themes, aren't they? So, but what I'm happy to do is, if anyone has any burning areas of priority that you think the theme in general or the sub-theme should be focusing on, I'm happy to relay that back to the group when we get the opportunity.
Can you just repeat those themes again, please? Sorry.
Yeah, sorry. So it's children and working age disabilities, older adults and dementia, and end of life and palliative care. So I guess if we wanted to, I don't know if they've done this on purpose. I don't want to speak for the theme leads, but that sounds like the whole life course, doesn't it? So children and working age, older adults, and then end of life and palliative care. But obviously, end of life can be at any age. Does that help? So they've got their own themes, and they're likely to be doing work within those. If there's any, maybe there was a reason you joined the social care theme, a burning area of research that you're interested in, or a burning question that you've always had. I'm happy to bring that back to the floor when they open it up for general discussion.
Hello, this is Carla.
Hi, Carla.
Yeah, I'm not sure whether it's a research question as such, but I'm just wondering about when a young person turns 18 and the level of care that drops for them. I guess I'm interested in exploring that and what further support is in place for young persons when they turn to that age.
Okay, so something around the kind of the transition between from turning for young people, young persons to well, I guess 18 plus.
Yeah, like the transition of care.
Yeah. Okay. Got James as well, who's also flagging that as being an area of interest. So maybe, and Anne, I can see your questioning. Maybe we need to that children and working age is quite a broad group. Actually, those few comments are all kind of intertwined, aren't they? There's something around not grouping them all together, which I'm not sure the theme is necessarily saying they'll do, but it does look at it just from the title, doesn't it? Children and working age disabilities.
That might be one. The other observation I would say is.
Thanks, James. So Alan may be here. I'm new to the ARC Northwest Coast. So if you haven't heard my voice before, or I know who I am, then that's why. He may be here, but I wouldn't know.
But in my hospital, I see cases where people die alone. Some people want to die away from their family.
Disabilities, including neurodiversity and maternity. Okay. Might be specific areas. Care as well that we might be worth exploring.
So I guess like Lizzie's what thinking about.
So just to get us thinking, then, is there what do you think are the big problems in social care? I know there's many, but do you have a feel for what the where the focus should be on? So is it funding? Is it workforce? Is it the way it's provided? Have we got that right in England, or in the Northwest Coast even? Are there alternative ways that we could provide social care more generally across all of those different bands that would be worth exploring in research. So I'm saying this as a health economist who's interested in the way we organise and provide care, but interested to see if there's any thoughts from the group here. Equity of hospice at home services. Yeah, so there's probably a lot of inequity in the way that social care is provided as well. There's it's very much a mixed market, isn't it? And how does that translate into equitable service provision would be a big question. I know that's not specifically what you're asking, Gillian, but I think it links to that.
Engage with the wider community, so it's not just largely
So, and if I'm understanding right, we have further distinction within the children age groups as well. And specific needs for subgroups of the population. So equity is something that's coming through. And by all means, if you're happy to, you can unmute and have a discussion. Then you don't have to hear my dulcet tone, which is probably boring you all.
Community within, say, the Blackburn area. Have you got any network set up? And they're like, no, but we'll see if there's another area that is set up. So we work closely with the foreign guests.
You can't see me doing this, but I'm actually making some notes so that when the opportunity comes, I'll feed this back to the group.
It was a long time after the
Just bear with me 1 second.
He'll put that and say, social organisation are still working together. Working together. But it was quite successful doing it. One person, I think.
Representative members of public and organization. It's a cost. I know that we Cambridge have got areas where it's virtually impossible to engage with most vulnerable as public representatives in other communities. So maybe not ideal, but proxies, voices, professionals who work with them, can be meet with those people every day, asking them right questions.
May be able to hear Clarissa's more.
Yeah. Well, just that body
Yeah, it's working out.
Do you want me to unmute it for his?
Hang on.
Yeah, if they can hear what is happening there.
Super. So it'd be great if we can have a little bit of top-level feedback from each table, including Will, who has kindly facilitated the online discussion. Who wants to start from the three tables? Any volunteers? Ooh, Sandra's really keen that Stephen is starting. So maybe end of life and pal care starting to feedback.
Okay. Thank you. Yes. So we were just having discussion because this is a new group, and it's just quite an open discussion to think about. Well, if we were sitting here in a year's time, what would success look like, or what would be interesting enough for people to come back to this table in a year's time and think, well, actually, that was quite useful. And so we did try to think about, well, what are the core needs for kind of people at the end of life, and how can we establish that? But then we quickly moved on to thinking about the inequalities that there are within our region and how we can do more to understand those, because I think within the research, the evidence base in palliative care is quite limited anyway, and in paediatric palliative care is even more limited. But what can we do, or how can we use the ARC and the public champions and the different methodology groups that there are to really try and engage people from different ethnic communities, underserved communities, marginalised communities, to understand their experiences in terms of the challenges that they face in end-of-life care. And there was discussion of the Corin network, which was part of the last ARC, and how that might be a useful group to engage with, to try and, in this first year effectively, set the objectives for how this sub-theme would move forward, but also that the sub-theme would also link with the sub-theme in long-term conditions, which Edward kind of leads, but also needs to feed into women's health and needs to feed into public health as well. So it's maybe more of a cross-cutting sub-theme. I'm not trying to give myself more work, but that, yeah, it bleeds into everything. So I think it's a little bit of that forming stage of this group in terms of what the objectives are and can be. But again, I think, you know, as I say in different meetings, human mortality still runs at 100%, you know, and that's not going to change. So it's everybody's business, really. So hopefully we can then find a way to make that everybody's business in all of the ARC themes moving forward. So.
Thank you. I don't know who was identified by you now. Is it Megan, Andy, Mark? Okay, Andy. Sorry. You're getting a mic in a sec.
Thanks, Mark, for identifying me. So we spoke about readily implementable and practical ideas, and there are lots of different ones on this sheet of paper. I'm probably going to miss some out, so please do chip in if I don't capture the essence of what was said. So we spoke about the changing colours of mugs on, I think that was hospital wards, wasn't it, that led to increased levels of hydration. Developing the work that Clarissa's been doing about gamification to further training and education. Lots of stuff around apps and technology like Alexa. Is that Sandy? To remind and prompt. Chatbots, AI, sensors, cameras for falls, but obviously there are lots of issues with privacy. An issue was raised about how when people get needlessly moved around wards, it can lead to unnecessary levels of confusion. So that seems to be something that we can address quite easily. Falls banned and a move to a preventative approach. Picking people up off the ground, and I think there was a conversation about being unable to physically move people if they fall, and how to kind of navigate that problem. Which can kind of escalate into other things like pressure sores and whatnot. Lots of issues with wearables and glasses. Apparently, was it Google who said something about Google glasses? Then Meta glasses apparently aren't taking off. So there's a thought as to whether they can be sort of parachuted into the healthcare system, maybe. So lots of things. I've probably missed some out as well, have I? If anybody else wants to chip in.
That's fine. I think we're running out of time a little bit. But yes, so we've got a diverse thing, so we need to sit down and identify that for year one. And Kate, on your table?
Okay, so we've had an initial discussion just thinking about some of the initial ideas of where there's need or different things that have come up, and please chip in, everyone, if I'm missing stuff out. But so looking at, in the working age, temporary accommodation, employment and disability. So thinking about accessing and maintaining that, and how that may also roll into other issues around housing. hope I'm capturing correctly. Also thinking about transition of young people with life-limiting or complex care, preparing the services and the families for that and how we look at it. And it's been mentioned around the Social Care Wales work that identified the top 15 priorities around transition. So we'll be having a look at that. Also raised around the complex household work, and I'm probably not going to cover this properly, so excuse me, but I'll do my best. In terms of looking at what does that complexity look like for families, and whether or not we look at the redefining that to look at things around the issues that are going on, impact for clinical decision making, and there'll be a lot more on this in future meetings because I'm sure we'll broaden that understanding, because that's the first time I'm hearing much about it, so excuse me if I'm not covering that very well. But also looking at intersecting inequalities and how that may impact on access to care. So lots of initial ideas which will obviously need lots of working up and further discussion to think about informing the work plan.
Great, thank you. And last but not least, do you want to?
Yep, just a couple of things to add. So transitions was raised as something of interest as well to the group online. Thanks everyone who was online, who bared with us there. There was a discussion around recognising that even within those sub-themes, there'll be separate groups and particular groups of the population within those. So you know, the older age is quite a broad age group in itself, and there might be differences within different groups there. And then an interest in looking at and recognising that the market's complex, multi-agency, different funding criteria, what's the role, the impact on inequalities as well. So an interest in inequalities. So sorry if I haven't done you justice. Those of you online, do put things in the chat. I think we're recording that anyway, and we'll feed that back to the group. Thank you.
Thank you, and I see the cookies being delivered, so thank you everyone. We're going to write some of that up, and you'll see probably an email coming from us. Thank you very much.